just because we're in a good position for it. So you guys can think about it. This position is a great place to do a posterior glide as well. So with posterior glide, there are different ways to do it. I like to keep them in this position here because I feel like it's a nice comfortable position for them. What I do is give just a little bit of kind of traction through my wrist here, my arm here a little bit, and then also just a little bit through this hand, but I don't worry as much about getting a ton of traction because it's just kind of a little grade 1. So you don't have to feel like, how am I supposed to really get a lever on this to distract it? It's not something you worry about so much as just giving a little distraction here. Putting your hand on top here. Now, if we're doing this mobilization, let's have you scoot this way. Okay. If we're doing a posterior glide, we're going to try to move the humerus posterior on the glenoid, right? So, in this position, once we press back on the humerus, the table is actually blocking his scapula, so it's allowing us to do that posterior glide. I want you guys to keep that concept in mind. If the table wasn't here, then or if he's scoot this way some, if he's potentially this way, potentially the table is not blocking it as well, depending on how far you want to actually put that mobilization, especially if he was flipped over on his stomach and you were trying to do a posterior glide, then the table wouldn't be able to block it as well. So, that being said, I don't mind him necessarily being right here because I still think I can take up the tissue slack enough to get a posterior glide on him, or you can have him off the edge of the table. Sometimes people even put like a towel or something under the scapula here to block it a little bit more. For right now, I just want you guys to more focus on what motion am I doing with posterior glide. So let's get our treatment plan back up here. So if we have if it's facing lateral, kind of superior and anterior, then our posterior glide, if you guys can see this, is going to go out this direction, right? Okay? So I'm going to just keep that in mind, that I'm going out this way. I'm going to distract here just a little bit, find his acromion process, come off of that onto the humerus, use kind of my hypothenar eminence here and really just my hand, kind of my hypothenar eminence and palm of my hand somewhere in here. I don't really have a specific place that I'm just thinking right through here, but I put my hand in here and then I do my posterior glide right here. Okay? So right now I'm really just doing probably a grade 1. You guys see there's not much movement. I can go in further and do a grade 2, further and doing a 3, or even a 4 at end range here. And I'm actually, when I'm doing grade 3s and 4 here, I'm not actually pushing him all the way through, but I just want you guys to be able to think about those resistance barriers. So I'm trying to think if there's anything else I want to say about this. I think that's mainly it. Get in the same position as you were before. Make sure the patient feels supported. Get your hand around their elbow. And in here, you can give a little traction here. Don't worry if you don't feel like you can get a ton, because remember, that's just a grade 1. It's just breaking bonds. Just enough. Put your hand here. Do your mobilization like this. Or if I'm standing up, like this. Okay? Cool? Alright. Alright. Let's let you guys